every carnivore blood work video on YouTube shows you one person's results. I got the data from 50. I'm Dr. Abs. After retiring from dentistry, I went back to university as a postgraduate to study metabolic medicine and anti-aging medicine, amongst other things. I'm also certified in sports nutrition, which means I might just understand the metabolic side of diet and performance. Over the past 18 months, I've collected comprehensive blood work from 50 real patients following a carnivore diet, and I've measured a lot: total cholesterol, HDL, triglycerides, A1C, fasting glucose, fasting insulin, inflammatory markers like CRP, hormonal markers, and some of the less commonly discussed metrics that actually matter for cardiovascular assessment. The reason I'm showing you this data is simple. If you've ever had a doctor look at your carnivore blood work and panic, or if you looked at your own results and felt confused because one marker looks great and another one looks alarming, this video is going to give you the context you've been looking for. This isn't a, it's not a one-person anecdote. It's not an outlier case. This is 50 real patients, and their actual data tells a much more nuanced story than you might have heard elsewhere. And there's one marker where the results genuinely surprised me, one finding that I didn't expect to see across this cohort. I'll get to that. But first, let me show you the data set, the methodology, and then we'll walk through each category of results together. So this is observational data from my clinical practice. It's not a randomized controlled trial. We don't have a control group eating a standard Western diet for comparison, but it is a large aggregate carnivore blood work data set that's not very common to see, and that matters. These are real patients who came to me, provided informed consent, and allowed me to track their labs over time. Now, our cohort includes 50 patients ranging from ages 22 to 74. The gender split, I've got everything written down here. The gender split is roughly 60% male and 40% female. So let's start with the marker that causes the most anxiety: cholesterol. This is the one your doctor talks about. This is the one that's made some of you seriously consider whether you're making a mistake by eating carnivore. So let's look at what actually happened across all 50 patients. The mean total cholesterol across the cohort at baseline was 204 milligrams per deciliter. After establishing their carnivore diet, and I'm averaging across patients at various time points here, mean total cholesterol moved to 312. So it went up on average. But here's where the distribution matters. Some patients' total cholesterol only went up around 10%. It's not a uniform response. Bear in mind that carnivore is exhibited very differently by every patient. If they eat 80% meat and 20% other stuff, that other stuff is different for everyone, and it has a different effect as a result overall. Now, HDL, the one that people label as good, even though the cholesterol carried is identical in both LDL and HDL. This one increased too. Mean HDL went from 21 milligrams per deciliter to 61.9. That's a meaningful increase. And triglycerides dropped dramatically. Mean triglycerides went from 152 to 89. That's a 38% reduction on average, which means the triglyceride to HDL ratio, which is a much better correlate of cardiovascular health than LDL alone, improved substantially. Now, the mean triglyceride to HDL ratio across the cohort was 1.8 at baseline, and after establishing carnivore, it dropped to 1.1. And the optimal range, the range associated with the best cardiovascular outcomes, is said to be below 2. So most of these patients are in a good place on that metric. However, I personally believe that symptoms are not the most important. That symptoms are the most important thing, and not numbers. But that being said, I would suggest that less than 1 is ideal, if at all possible. Many did actually get less than 1 and felt fantastic. However, some had their triglycerides increased because they were in the middle of improving their body composition and getting rid of excess fat. This kind of thing would skew triglyceride to HDL ratio calculations typically. Now, if you've had this measured, what is your trig to HDL ratio? Drop it in the comments. I'd love to compare it to the cohort data. If cholesterol, though, is a worry marker, A1C and insulin are the redemption markers. This is where the data becomes genuinely exciting, because this is where we see consistent improvement across nearly the entire cohort. Mean A1C at baseline was if I can find it, 6.2%. That's pre-diabetic territory for many people. But after establishing their carnivore diet, mean A1C dropped to 4.5%. That's a 1.7% reduction on average. And more importantly, of the patients who began with elevated A1C above 5.7, which is a sort of conventional threshold for prediabetes, all of them improved. And 12 of them had their A1C normalized to below 5. 2 patients who were type 2 diabetic at baseline with A1Cs of 8.1 and 8.4, both achieved A1Cs below 5.5 within 1 month on a carnivore diet. That's type 2 diabetes reversal measured objectively. Now, fasting glucose followed a similar pattern. Mean fasting glucose dropped from 153 milligrams per deciliter, or 8.5 moles, down all the way to 90, or 5. Now, for context, below 8 in the UK is considered normal fasting glucose, and these patients cross that threshold consistently. Not that we were aiming for a number, of course. We wanted, symptom improvement above all else. But here's the metric that matters most, and that almost nobody measures: fasting insulin. It's the most sensitive marker of metabolic health and physiological insulin resistance. Mean fasting insulin at baseline was 9.8 milli international units per liter. After carnivore, it dropped to 4.2. That's a 57% reduction. The optimal range for fasting insulin is below 3, and we had approximately 38% of the cohort achieve that. But even those who didn't quite reach below 3 saw dramatic improvement. HOMA-IR, which is a calculated measure of insulin resistance combining fasting glucose and fasting insulin, improved from a mean of 2.6 down to 0.92. A HOMA-IR below 1 is considered excellent insulin sensitivity. Almost 80% of our cohort achieved that. So when you look at metabolic health holistically, glucose level, I'll put this down, glucose level, insulin results, and A1C, carnivore is genuinely transformative in my personal experience. It's not a marginal benefit. It's a category-shifting improvement in metabolic health. If your doctor's watching your A1C and you're fasting glucose and concerned about your carnivore diet, show them this data. This is what metabolic healing looks like for me personally. But beyond metabolic health, there are other systems at play. Many people adopt carnivore specifically because they're dealing with chronic inflammation, autoimmune conditions, or just general malaise. So let's look at what happens to inflammatory markers if I get my writing here again. High sensitivity CRP, that's high sensitivity C-reactive protein, the standard marker for systemic inflammation. Mean CRP went from 3.2 milligrams per liter to 1.1 milligrams per liter. For context, below 1 is considered low inflammation, and above 3 is associated with increased cardiovascular issues and systemic inflammation. So we saw a significant shift from elevated baseline to well-controlled inflammation. More than 75% of the cohort achieved a CRP below 1.5. Homocysteine, which is another inflammatory and cardiovascular marker, also improved. Mean homocysteine went from 10.8 micromoles down to, where has it gone? 9.1. The optimal range is below 10, so we move the average into the better zone. Now, hormones. This is where things get a bit more interesting. Testosterone, at least in the male subset of our cohort, roughly 30 patients, increased meaningfully. Mean testosterone went from 490 nanograms per deciliter to 620. That's a 27% increase on average. I'm aware that I think it was the Carnivore couple, they published testosterone results showing increases from 440 to about 600, about a 35% increase, and those numbers generated really good engagement. Our data is slightly more conservative, but it's still real and meaningful. You have to understand that different clinics will have different patients come to them in different states of health to start with, and every patient transitions at a different speed too. Now, we didn't see any adverse effects or markers or on markers like SHBG. The improvements seem to be genuine increases in free testosterone, not just changes in binding proteins. Now, thyroid markers, like TSH, free T3, free T4, these varied more between individuals because we had quite a few patients with either under or overactive thyroid to begin with, And this made averaging the numbers a bit of a useless exercise here, unfortunately. But all patients with thyroid problems had resolution nonetheless, which is the important thing. What this tells us, I can put this down again, what this tells us collectively is that carnivore isn't just about glucose and insulin, it's about reducing inflammatory load and supporting hormonal function. For many people, that translates into better energy, better body composition, better mood, better overall resilience, shall we say. For example, increased insulin from things like dietary carbohydrates limits the conversion of testosterone to estrogen for women. And you wonder why some overweight women go into early menopause. The root cause is what people should aim to address, not the symptoms. The symptoms are just a way of measuring progress. Now, what do you actually do when cholesterol goes up on carnivore? Everyone will tell you either LDL doesn't matter or LDL is everything. Go on statins. I'm going to try and give you a framework. The actual framework I use with patients in my clinic. When a patient's LDL goes up on carnivore, here's what I do when it comes to the rest of the blood test. First, I check the full lipid picture. I look at HDL, triglycerides, and calculate that triglyceride to HDL ratio. If that ratio is good, below 1, and HDL is above 50, I feel that it's safe to tell the patient that they can relax. A lot of people may recommend a coronary artery calcium score, a quick, non-invasive CT scan that shows whether there's any calcified plaque in the coronary arteries. Now, if the calcium score is 0 or near 0, we have extremely strong evidence that LDL elevation is not translating to plaque burden or risk for that individual. However, the reason I don't like to request these things by default is that there's a radiation dose associated with it that just isn't warranted in the vast majority of cases, in my view. So what if you get the scan? What do you do? Because it's not going to change the advice around diet, exercise, sunshine, sleep. So what have you gained from doing it in practical day-to-day terms? Nothing. If we do it though, then at that point the conversation becomes, your LDL is elevated, your other lipid results are good, your calcium score is 0, so therefore we have no evidence of vascular disease. The LDL elevation is likely not a clinical concern for you. Now, I do have a few videos on LDL on this channel if you want more info on it, and I also have several lessons on it in my online school where I teach topics like this live every single week and where members post their blood work and we all discuss it to help each other out. I'll leave a link for that in the description if you're interested. But the point is this. We have a clear decision tree. We're not ignoring lipids. We're not panicking about LDL either. We're investigating it thoroughly and acting based on evidence. In our cohort of 50 patients, 43 had LDL elevations that would put them in line for statin therapy if you were to follow national guidelines. Of those 43, 3 did coronary calcium scoring for various reasons. All 3 had calcium scores of 0. They were counseled that their LDL elevation was not a cardiovascular red flag, that they felt genuinely better knowing they had actual evidence and not just a number and a generic recommendation to go on a statin. So here's what I tell my patients. If you're going to have elevated LDL on carnivore, this is a good time to actually understand your cardiovascular health in detail, because most people just get told the LDL is high and then get advised to take medication. But now you've got a chance to actually know whether you have plaque. Use that opportunity if genuinely warranted. Let me summarize what 50 patients' worth of data actually shows us. First, metabolic health transformation is real and consistent. A1C drops, fasting glucose improves, fasting insulin plummets, and insulin sensitivity measured by HOMA-IR gets dramatically better. If you're physiologically insulin resistant or pre-diabetic, carnivore for me is one of the most effective interventions we have. That's the data talking, not me. Second, lipid profiles are more complex than LDL alone. Yes, some people's LDL goes up, but most people's triglycerides go down. HDL goes up, and the ratio of triglycerides to HDL, which is a better predictor of actual cardiovascular issues, improves significantly. There's a net positive for cardiovascular health for the vast majority of people in this cohort. Third, I think, inflammatory markers improve. CRP drops, homocysteine normalizes, and for many people, the cascade of inflammation that drove them to carnivore in the first place resolves. That matters for how you feel and for your long-term health. Number 4, this is observational data from my practice. It's not a randomized trial. These are self-selected patients who chose carnivore and came to me for monitoring. That means there's some bias toward people for whom carnivore works. But it also means this is real data from real patients making real dietary decisions and seeing real outcomes. And I think that's a much more useful thing than a theoretical model. So what should you take from this? Well, honestly, I would say that getting bloods is useful sometimes only for people like me who want to study the biology of what's happening so they can teach it to others and add to our collective knowledge base. For the vast majority of you as an individual, I honestly don't think it's that useful, to be honest. So what if your level of this or that is high? The advice of building muscle mass and scrapping processed food is still the same. So what's the point? And as well as that, every patient here in the data was so different to each other. Some had longer transitions on the diet, some were very instant, some were underweight, some were overweight. You actually can't really take this data and apply it to yourself because you're that different to the next person that looking at stuff like this is purely for like entertainment purposes, to be honest. And if you're thinking of going carnivore from this, or maybe for other reasons, here's my number 1 tip, and this isn't clickbait either. Lots of people try lots of diets and some get great results. Some get poor ones. This comes back to everyone being so different. Carnivore means, roughly speaking, 70% animal products as far as people say nowadays, but that 30% can make the difference between resolving health problems and not. So how do you determine what makes up the 70% and the 30% for you? Some people have problems in transition to carnivore thinking it'll resolve the issue, but eggs aren't agreeable for their bodies and they have no idea. So they keep eating them and think the whole thing doesn't work. The truth is, there's someone in this world who gets the highest success rate I've ever seen clinically when transitioning people to this way of living. And she has published literature in resolving things like tumors and autoimmune conditions innumerable times. And what's amazing is that her transition for her patients is instant. There's no period of weeks or months to slowly cross over. That's because she's figured out how to do it perfectly. No transition period, and it yields success consistency like you've never seen, and pretty much no adverse reactions of any kind. The clinic she works in is called Paleomedicina in Hungary, and her name is Sophia Clemens. I probably said it wrong though. Her discoveries in this field have led her to label her method the PKD, Paleolithic Ketogenic Diet. In my view, all the clinicians you see making videos in this space, like me, so I'm talking Ken Berry, Anthony Chaffee, Richard Smith, Bart Kay, many, many more, she is number 1. I don't have time to fully explain here why, but honestly, she understands nutrition and its effects on the body better than anyone else I've ever seen. Read her work and it will pay you back for the rest of your life. In my own clinical practice, I employ many of her principles, and hopefully one day I'll be as good as her in clinical care too. But if this data today changed how you think about carnivore blood work, share it with someone who's been worried about their labs. Share it with someone whose doctor told them carnivore is dangerous and they need to stop. They might find the same reassurance and the same framework that I'm offering here. I'm not trying to tell people to ignore their doctors. I'm trying to give people the context and the tools to be better collaborators with their doctors.